So how do we treat with these particular patients, and how do we manage these patients of hydrocephalus when once we have diagnosed them to be suffering from this condition of hydrocephalus? Apart from the normal cognitive behavioral therapy that we're going to start off and start educating the patients regarding this particular condition that we have in the child, and we have to basically educate the parents regarding the fact that what would be the particular prognosis of this condition overall in the child. So we'd start off with the treatment options that we have. First of all, we can start off with the medical management in the patient and couple this up with the surgical management at the appropriate time. And then obviously there is going to be a continuous nursing management that is going to being observed by any of the caregiver of the child, or it can be even the mother of the child, who has to be educated regarding the particular nursing techniques that she has to basically observe in the child. Because the feeding is usually not appropriate and there is an inappropriate behavior that is noted down in these particular children. They are quite irritable, and so there has to be a complete nursing management that is given to the caregiver or to the mother of the child as well. So the medical treatment has to basically encompass, there are these particular drugs that are quite helpful, and they're basically the drugs of choice for the treatment of hydrocephalus. Namely, we have the oral glycerol, which is again quite helpful in decreasing the intracranial pressure. And then we have the acetazolamide, which is usually the drug of choice. It is given in a dose of 50 milligrams per kilogram per day. Now, what is the basic mechanism of action over here? We just went through the fact that the production of the CSF is basically under the effect of the carbonic anhydrase, and we can basically inhibit this hormone by giving the acetazolamide, which is basically a diuretic. So when you start giving this drug, it's basically inhibiting the production of the CSF by the ependymal cells, and that is going to basically lower down the intracranial pressure. So this is the basic mechanism of action, and why do you basically use this particular drug for the patients of the hydrocephalus. And basically the normal dosing has to be also kept in mind and calculated for in particular patients, and you have to basically obviously weigh the patients and accordingly adjust the dose for the particular patient whom you're treating.